I want to talk to you today about something a fair number of older adults experience and rarely connect to their heart or their health beyond mild annoyance. Yet that can carry useful messages worth understanding. A persistent dry mouth or persistent excessive thirst. And there's sometimes overlooked connections to medications, hydration, the heart, and other conditions. Because we tend to dismiss a dry mouth or being thirsty as just needing a drink or a quirk of getting older. Yet persistent dry mouth and persistent excessive thirst can each relate to medications, including heart medications, to dehydration, which I've discussed strains the heart, to diabetes and to other conditions. So understanding when these might be more than a passing matter is genuinely worthwhile. So today I want to explain what dry mouth and excessive thirst can reflect, the medication and heart connections, the link to dehydration and diabetes, when they warrant checking, and what to do in partnership with your doctor. And I'll keep this calm and balanced because while these are often minor, they can sometimes point to things worth addressing, and understanding them lets you respond wisely in partnership with your doctor. This is about reading two overlooked symptoms sensibly. Let me start by distinguishing dry mouth from thirst, because they're related but different. Let me start by distinguishing two related things. A dry mouth is the sensation of insufficient saliva, your mouth feeling dry, sticky, or parched, which relates to saliva production. Excessive thirst is a persistent, strong desire to drink, feeling thirsty often or unable to quench it, which relates more to your body's fluid and other balances. They can overlap, and both can come from some shared causes, but they're somewhat different symptoms with somewhat different implications, so I'll address both. Understanding that dry mouth is about saliva, while excessive thirst is about your body's drive to drink, helps make sense of their causes. So dry mouth is about insufficient saliva, while excessive thirst is about a persistent drive to drink. Related but somewhat different symptoms worth distinguishing. So understanding the distinction frames their causes. So dry mouth and thirst are related but distinct. Let me explain the medication connection because it's a very common and relevant cause. A very common cause of dry mouth, and sometimes of thirst, especially in older adults, is medications. A great many medications cause dry mouth as a side effect, including some used for blood pressure and heart conditions, water tablets, diuretics, and many others common in later life. So if you have a persistent dry mouth and take several medications, they're a likely contributor. Water tablets, by increasing fluid loss, can also contribute to thirst. Crucially, the answer isn't to stop your medications, but to mention a troublesome dry mouth or thirst to your doctor or pharmacist who can review your medications, consider whether any are responsible, and advise, sometimes adjusting them or suggesting measures without you stopping anything on your own. So a very common cause of dry mouth and sometimes thirst is medications, including some heart and blood pressure ones, and water tablets. So mention a troublesome dry mouth or thirst to your doctor or pharmacist for review without stopping medications yourself. So medications are a common reviewable cause, so dry mouth is often a medication side effect. Let me explain the dehydration and heart connection, because it ties to themes I've discussed. Dry mouth and thirst connect to hydration, and through it, to the heart. Thirst and dry mouth can be signs of dehydration though. As I've discussed, thirst is an unreliable guide in older adults, so being underhydrated matters regardless. And dehydration, as I've discussed, strains the heart and circulation by reducing blood volume and making the heart work harder. So staying well hydrated matters for your heart. Conversely, in some heart conditions like heart failure, the relationship with fluid is more complex, and some people are advised to limit fluids, as I've discussed, so the right hydration approach can be individual. So dry mouth or thirst can prompt attention to your hydration, which matters for the heart, while remembering that those with certain heart conditions should follow their doctor's specific fluid advice. So dry mouth and thirst connect to hydration, which matters for the heart since dehydration strains it, while those with conditions like heart failure should follow their doctor's specific fluid advice. So hydration links these symptoms to the heart. So dry mouth and thirst tie into hydration and the heart. Let me explain the diabetes connection, because it's genuinely important. A genuinely important cause of persistent excessive thirst in particular is diabetes. When blood sugar is high, as in diabetes, the body tries to get rid of the excess sugar through the urine, which draws out water, causing increased urination, and, in turn, excessive thirst and sometimes a dry mouth. So persistent excessive thirst, especially with passing a lot of urine, is a classic symptom of diabetes or of diabetes being poorly controlled. This matters because diabetes is common, important to diagnose and manage, and itself a major risk factor for heart disease, as I've discussed. So persistent excessive thirst, especially with frequent urination, increased hunger, fatigue, or unexplained weight loss, warrants checking for diabetes, which is important both in itself and for the heart. So persistent excessive thirst, especially with frequent urination, can be a classic sign of diabetes, important to diagnose both in itself and as a major heart risk factor, so it warrants checking. So thirst can signal diabetes, which matters for the heart. So excessive thirst can be an important diabetes clue. Let me note other causes and why dry mouth matters for health, because it has its own effects. Beyond medications, hydration, and diabetes, dry mouth and thirst can have other causes worth a doctor's consideration, including certain other medical conditions, salivary gland problems, mouth breathing, and others. And persistent dry mouth matters for health in its own right, because saliva protects the mouth, so a chronically dry mouth increases the risk of tooth decay, gum disease, mouth infections, and difficulty eating and swallowing, which is why it's worth addressing, including, as I've discussed, since gum disease connects to heart health. So persistent dry mouth is worth addressing both to find any underlying cause and to protect your mouth and teeth. So dry mouth and thirst can have other causes, and persistent dry mouth itself harms the mouth and teeth, increasing decay and gum disease risk, so it's worth addressing. So dry mouth has its own health effects worth addressing. So persistent dry mouth matters for oral health too. Let me be clear about when these warrant checking, because that guides you. See your doctor for persistent excessive thirst, especially with frequent urination, increased hunger, fatigue, or unexplained weight loss, to check for diabetes. Persistent or troublesome dry mouth, especially if you take several medications to review them and find any cause. Dry mouth or thirst with other symptoms, or that's new, marked, or unexplained, or signs of dehydration, as I've discussed. The doctor can review your medications, check for diabetes and other conditions, assess your hydration, and advise. And mention dry mouth to your dentist too, given its effects on your teeth and gums. By contrast, an occasional dry mouth or thirst with an obvious cause, like a dry environment or needing a drink that resolves, is usually benign. So see your doctor for persistent excessive thirst, especially with frequent urination, for troublesome dry mouth, especially on multiple medications, or for these symptoms with other features, to check for diabetes, medication causes, and other conditions. So heed persistent thirst or dry mouth with your doctor. So persistent or symptomatic thirst or dry mouth warrants checking. Let me give you the sensible measures and what to do, because much helps. So here's what to do. See your doctor for persistent excessive thirst, especially with frequent urination, to check for diabetes, and for persistent or troublesome dry mouth to review medications and find any cause without stopping medications yourself. For managing dry mouth, sensible measures help. Sip water regularly. Stay well hydrated, following your doctor's fluid advice, if you have a relevant heart condition. Avoid things that worsen it like caffeine, alcohol, and smoking. Consider sugar-free gum or saliva products your dentist or doctor can suggest. And keep up good oral care and dental visits given the decay and gum risks. And address the underlying cause with your doctor, whether a medication, diabetes, or another condition. So see your doctor for persistent thirst or dry mouth to find the cause, manage dry mouth with sipping water, good hydration, avoiding worsening factors, and oral care, and address the underlying cause, so get it checked and manage it sensibly. So there's much that helps. Let me paint you a quick picture of how this helps. Picture a man in his 70s with a persistent dry mouth he's just put up with, who's also become noticeably more thirsty, drinking and urinating a lot, with some fatigue, which he's dismissed as aging. Understanding that persistent excessive thirst with frequent urination can signal diabetes, and that dry mouth can relate to his medications, he sees his doctor, who checks and finds his blood sugar high, diagnosing diabetes, important both in itself and as a heart risk, and starts managing it while also reviewing his medications, some of which were drying his mouth, and advising measures and dental care. His thirst and dry mouth improve as his diabetes is controlled and his medications adjusted, and an important heart risk factor is now being managed. The same man but reading his thirst and dry mouth as worth checking rather than dismissing them, got diabetes caught and his mouth helped. That contrast is exactly why reading these overlooked symptoms sensibly matters. Let me speak briefly to those of you caring for an older parent or partner. Understand that persistent dry mouth and excessive thirst can relate to medications, including heart ones, to dehydration, which matters for the heart, to diabetes, which is important both in itself and as a heart risk, and to other conditions, and that persistent dry mouth also harms the mouth and teeth. You can help by encouraging a loved one to see their doctor for persistent excessive thirst, especially with frequent urination, to check for diabetes, and for troublesome dry mouth to review medications without stopping any. Support good hydration, following the doctor's fluid advice, if they have a relevant heart condition, sensible dry mouth measures, and good oral care and dental visits. Helping a loved one read and address these symptoms can catch diabetes, identify medication causes, protect their mouth, and support their heart. So let me draw this all together. A persistent dry mouth and persistent excessive thirst, often dismissed, can carry useful messages. Dry mouth, about insufficient saliva, is very commonly a medication side effect, including from some heart and blood pressure medications and water tablets, so it's worth a medication review, without stopping anything yourself. And persistent dry mouth also harms the mouth and teeth. Both can relate to hydration, which matters for the heart since dehydration strains it, though those with conditions like heart failure should follow their doctor's specific fluid advice. And persistent excessive thirst, especially with frequent urination, can be a classic sign of diabetes, important to diagnose both in itself and as a major heart risk factor. So see your doctor for persistent thirst, especially with frequent urination, or for troublesome dry mouth, especially on multiple medications, to check for diabetes, medication causes, and other conditions. Manage dry mouth sensibly and keep up oral care. So here's what I'll leave you with, straight and clear. First, understand that dry mouth, about insufficient saliva, and excessive thirst, about a persistent drive to drink, are related but distinct symptoms worth heeding when persistent. Second, know that dry mouth is very commonly a medication side effect, including from some heart and blood pressure medications and water tablets. So mention a troublesome dry mouth to your doctor or pharmacist for review, without stopping any medication yourself. Third, understand that these connect to hydration, which matters for the heart since dehydration strains it, while those with conditions like heart failure should follow their doctor's specific fluid advice. Fourth, know that persistent excessive thirst, especially with frequent urination, increased hunger, fatigue, or unexplained weight loss, can be a classic sign of diabetes, important to diagnose both in itself and as a major heart risk factor, so it warrants checking. And fifth, see your doctor for persistent excessive thirst, especially with frequent urination, or for persistent or troublesome dry mouth, especially on multiple medications. To find the cause, manage dry mouth with sipping water, good hydration, avoiding caffeine, alcohol and smoking, and oral care, and keep up dental visits given the decay and gum disease risks. A persistent dry mouth or excessive thirst can point to medications, diabetes, hydration issues, or other conditions worth addressing. So reading them sensibly and getting the concerning kind checked can catch important things and protect your mouth and heart, which is well worth doing. So take care of yourself, heed persistent dry mouth or thirst, get them checked. Manage dry mouth, keep up oral care, and stay appropriately hydrated. And because persistent thirst can signal diabetes and dry mouth can reflect medications or other conditions needing attention, please treat persistent excessive thirst, especially with frequent urination or persistent troublesome dry mouth, as your reason to see your own physician rather than dismissing them, and never stop a medication you suspect on your own.